for joining us in this very important and informative town hall meeting. My name is Rosie Martinez. I am the proud Gardena Community of Schools administrator, serving 17 schools within the city of Gardena. I am honored and pleased to be partnering with AADAP for a presentation today on vaping and flavored tobacco. So thank you for your partnership, our partnership with AADAP. We really appreciate you and helping keep our community safe. At this point, I'd like to go ahead and turn it over to Carol so that we can begin the presentation. Carol, it's all yours.
Yes, thank you so much, Ms. Martinez, and good evening, everyone. My name is Carol Almeida, Community Organizer with the Community Prevention Unit of the Asian American Drug Abuse Program and Project Coordinator of the Comprehensive Tobacco Control Services Project. We are privileged to take on the virtual stage tonight to discuss a compelling issue which may affect the health and lives of our youth. I am referring to flavored tobacco products, the harms they cause, and youth access to them. But before moving on and before proceeding, just a few housekeeping items. Please note, this webinar will be recorded and the recording can be accessed at a later date through the Gardena Community of Schools website and the Gardena GDAAP, that is Gardena Drug and Alcohol Abuse Prevention Coalition Facebook page. Also, there will be a question and answer portion after the presentation. And for those who would like to ask questions, there is the chat box. Just type in your question in the chat box. Okay, and so without further ado, let's move on now to the presentation. And may I call on my colleague, Ms. Jessica Abaya.
Perfect, thank you. Hello, and thank you for the opportunity to present today. My name is Jessica Abaya, and I am the community organizer in the city of Gardena with AADAP. So we'll actually start off with a short activity, as shown on the screen, titled Hidden in Plain Sight from the Tobacco Prevention Toolkit. I really love this toolkit. It is a great resource to have, and it features information on tobacco, vapes, nicotine, flavors, and so much more. In this photo, you will see a pretty common desk that is useful for students during their instructional hours. So during schools, you will see scissors, highlighters, pens, USB, of course, our hand sanitizer and tissue. But the one thing about this photo is that mixed in our everyday common items are vape devices. There are actually about 6 vape devices hidden in this photo. Can you spot all 6? Really? Carefully take a look, examine each pen, each highlighter. Now, if you were able to spot some, then kudos to you. However, let's take a closer look at the next photo. So here's the same photo with the red arrows indicating hidden in plain sight some vape devices. These vape devices look and resemble the everyday common materials students use for school to complete their assignments. We're now going to take you on a tobacco product overview. Let's start with an overview of flavored tobacco products. Flavored tobacco products is a term to describe all tobacco products that have an added flavoring. Flavored products can be categorized as conventional, like menthol cigarettes, smokeless tobacco, little cigars, and cigarillos. Popular brands include Swisher Sweets and large cigars. The other category is what we refer to as emerging or new products, like electronic, e-cigarettes, and vapes. So what are vapes and vaping products? Vapes or vaping devices, also known as electronic cigarettes, e-cigarettes, or electronic vaporizers, are battery-operated devices that deliver vapor. Sometimes they're called aerosol. They're made up of nicotine, flavorings, and other chemicals. It was actually first introduced in the United States in 2007. Sales of vaping devices skyrocketed starting in 2013 with marketing and advertisements aimed at the youth. The shapes and sizes of vape devices have changed quickly over the last 10 years. While vaping devices were the shape and size of regular cigarettes, vaping devices sold today range from colorful vape pens to modified tank systems to the new high-tech pod-based devices. Pods, they're really the next generation of devices. Some popular brands include Juuls and Puff Bars. Pods are removable cartridges which are pre-filled e-liquids, sometimes called e-juice or pod juice, that users connect to their device. Some pods allow users to refill the cartridge with an e-liquid. Similar to the older type of e-cigarettes or vaping devices, pod devices come in a variety of flavors like mint, fruit, candy, and dessert that do not taste or smell like regular cigarettes. Pod devices do not look anything like the traditional cigarettes or other e-cigarettes. They're high-tech looking and often look like USB flash drives, highlighters, and they're so easy to hide in schools and at home, similar to our short activity that we had earlier, hidden in plain sight. All pods contain high levels of nicotine. If you don't know, a standard pack of cigarettes contain 20 cigarettes. There is 1 milligram of nicotine absorption per cigarette, so about 20 milligrams of nicotine delivered to the body from a whole pack of cigarettes. According to Juul Labs, 1 Juul pod contains 41.3 milligrams of nicotine. This is equal to the amount of nicotine you would find in about 40 cigarettes. As mentioned earlier, the Juul and Puff bars are particularly very popular brands. So a question for all of you. How many packs of cigarettes would a Juul pod then be equal to? If you said 2 packs, you're correct. As mentioned before, this is a high amount of nicotine and can be intense for first-time users. Our concern is that young people are being introduced to a high amount of nicotine, developing a tolerance quickly and becoming addicted as a result. 1 Puff bar contains 50 milligrams of nicotine, which is equivalent to 50 cigarettes. So for parents, how many packs of cigarettes would a Puff bar then be equal to? It would be about 2.5 packs of cigarettes. This slide came from the Tobacco Prevention Toolkit and is a great resource to have and to reference for later use. I'm actually going to move on to flavorings. Flavorings mask the harshness of smoke and make products more appealing to new users, especially young people. Flavors mimic childhood favorites. These flavors are a great way to attract young consumers, such as the OMG flavor, a popular used phrase. In this case, Puff Bars OMG is orange, mango, and guava. These flavors include interesting flavors and bright colors to be attractive. A 2015 study of adolescents ages 12 to 17 found that among those who self-reported ever experimenting with tobacco, the majority started with a flavored tobacco product. It is also found that most current youth tobacco users reported use of flavored products. Young people are much more likely to use candy and fruit-flavored tobacco products than adults. Both the U.S. Food and Drug Administration and the Surgeon General have warned that flavored tobacco products help new users establish habits that can lead to long-term addiction. Not only do flavors make it easier for the new users to begin smoking, but the presence like menthol in tobacco products also make it more difficult for tobacco users to quit. There are currently 15,500 plus flavors on the market, and 80% of young people who have ever used tobacco products started with a flavored tobacco product like chocolate, mint, gummy bear. Really hooks the youth to tobacco use. I will now pass this over to my colleague, Carol. Thank you.
Thank you, Jessica. Tobacco products, whether they are conventional like cigarettes or emerging like vapes, electronic cigarettes, contain nicotine. Nicotine is toxic, harms the adolescent brain, which is still developing up to the age of 25 years, making it therefore susceptible to addiction. Experimentation in tobacco use, which is a common tendency among youth, can lead to long-term addiction. Nicotine liquid used in e-cigarettes can be dangerous. Both children and adults have been poisoned from exposure through swallowing, breathing, or absorbing liquid nicotine through their skin or eyes. Young children sometimes come across these products and ingest them believing they are candy. Poison center calls related to nicotine poisoning have increased as e-cigarettes have become more popular. Between 2012 and 2015, incidents increased by almost 1,500%. Outcomes range from severe to fatal. Aerosols in e-cigarettes pose other health risks, including tiny particles that reach into lungs and may be cancer causing. In 2019, there was a lung illness outbreak which health officials across the US observed to be severe and in extreme cases fatal that occurred in otherwise healthy individuals. As more data emerged, the one common risk factor that was identified was the use of vaping e-cigarettes. Thus, the Center for Disease Control gave it the name EVALI, which stands for Electronic Cigarettes or Vaping Associated Lung Infection. The situation was further exacerbated by the pandemic in 2020. With COVID-19, people who vape or smoke face greater risk of serious illness. Vaping and smoking weaken lung function and immunity. The National Institute of Drug Abuse, or NIDA, included vapers among the most vulnerable groups, a great number of whom would be youth, as they are 7 times more likely to vape nicotine than adults. In summary, tobacco products, including flavored tobacco, do not have any benefits to the human population. Let's move on now to availability and accessibility. If tobacco products, specifically flavored tobacco products, are harmful to health and the lives of our youth, why are they in the hands of youth? Where are the youth getting their tobacco products? The California Student Tobacco Survey has a set of data, and what you can see on your screen would be county data taken from the California Student Tobacco Survey. And the graph that you see on your screen, let me summarize it. Okay, 27.3% of LA County high school students who are current e-cigarette users paid for their own e-cigarettes or e-liquid at a retail store. 45.4% of LA County high school students who are current cigarette users paid for their cigarettes at a retail store, with nearly 80% of those students reported buying cigarettes from the store themselves or from someone else. There is the CDC Youth Risk Behavior Survey that would further reinforce this data. And these are data generated in 2017. 13.6% of high school students in Los Angeles Unified School District are able to get their tobacco products in a store, in a retail store, such as convenience store, supermarket, discount store, gas station, or vape store. In our very own community, Gardena, community prevention staff of AADAP conducted in 2018 and 2019 what we call a young adult purchase survey. And this is a data collection tool which is guided by the protocols of the LA County Department of Public Health. This is what we call an attempt buy, in which we ask youth volunteers aged 18 and 19 years old to participate and pretend to buy cigarettes, meaning they walk into the store, pretend that they're buying different tobacco products. It can be conventional, it can be emerging or new. And what did we find out? What are the results of this survey? 43% of Gardena tobacco retailers were willing to sell to young adults. I emphasize young adults between 18 and 19 years old because of the new California law, which raised the age of purchase and possession of tobacco to 21 years of age. So now that the students are back in school, we again refer to data. And it says here, in the California Tobacco Health Assessment Tool, that indeed 15.1% of retailers in LA County are within 500 feet of schools. 37.2% of retailers are within 1,000 feet of schools. So what do this data say, and what do this data emphasize? That retail outlets, retail stores are the main access points for tobacco products, including flavored tobacco products for our youth. So I'll pass it on again to Jessica for more resources and for more ways of educating and informing our community.
Perfect. Thank you so much, Carol. So moving on to resources, what you can do to prevent youth from vaping. So for parents, educators, teachers, administrators, let's continue to inform and educate ourselves on the harms of flavored tobacco and what it can do to the health and lives of our youth. On your screen, I would ask and invite you all to pull out your phone and take a screenshot of this or scan this and bookmark this on your phone. These two sites will provide you a wealth of information on tobacco and vaping. Learn more about vaping on some educational materials such as signs and symptoms for parents. I would ask you to look through Flavors Hook Kits, and you will actually be able to access how do you know if your youth is using or vaping. And then aside from this, we have AADAP Youth Outpatient Miriam Ruiz. She is the program coordinator. You can screenshot this. It has her email and her phone number, or you can scan this and save this and bookmark it on your phone for later. Aside from this, more information and resources as presented for today can also be found on CDC County of Public Health, and American Lung Association. Youth really need our support and guidance, and most of all, our action as a community to take away flavored tobacco from the hands of our youth. With this, I'd like to move over and pass it to my colleague, Tracy. Thank you. Tracy, you're on mute.
I'm so sorry. I thought I would do that. Let me start again. Sorry. Good evening, everyone. My name is Tracy Sadowatari, and I'm a community organizer with AADAP and the current chairperson of an adult coalition here in Gardena, Gardena Drug and Alcohol Abuse Prevention Task Force, GDAAP. We're always looking for new members. So if you're someone who likes to help the community, who wants to learn more about ways that you can help the youth in our community, and my contact information is on the slide here. You can contact me if you want more information. But with that, I'm going to give you a little bit more information of some of the work that we do in the community of Gardena. So as a coalition, our goal is to prevent youth access and the use of tobacco, alcohol, and other drugs through information, education, and community collaboration. In the field of tobacco prevention and control, our community-driven initiatives dating way back to 2004 have led to the passing of policies on smoke-free parks, tobacco retailer permitting and licensing, prohibition on the sale of single cigars, and regulation on the sale of electronic cigarettes. Since 2019, our focus has been around the issue of youth access and use of flavored tobacco products. Here with us today are three individuals to share their experiences and perspectives about the issue. All three are residents of Gardena. Randy Artemaya and Melissa Loza are active members of our adult coalition. They were recently some of our interns, and we kind of adopted them as our members of GDAAP. And Liz Zambrano is an alumni of our high school task force program, our high school task force youth program. With that, I'm going to pass it on to Randy to go ahead and start us off. So Randy, the floor is yours.
Thank you, Tracy. Greetings. My name is Randy Artemaya, a concerned Gardena resident about the issue of flavored tobacco being sold in our community. One of my concerns about flavored tobacco is the deceptive marketing strategy that these tobacco companies are using to target the youth who could potentially be their next future customers, who can be hooked to their product for life. For example, my little brother, who thought the flavors are harmless, just like flavorings found in candy or gum, yet vape products offer a variety of flavor in order to give the illusion that vaping is harmless, just like chewing gum, which makes my brother perceive vaping as a harmless activity since he does not feel any pain from using the product. However, I have to remind him that these vaping products that have flavors are covering the real truth behind what makes a product addicting. The flavor vapes contain nicotine, an addictive chemical, which is not good for youth whose brains are still developing. Since my younger brother just turned 21, he thinks he is mature enough to do vaping since he saw his coworkers using vapes around him during his break. Even though he is 21 years old, it still does not make it right for these young adults to use vapes since their brains are still developing until 25 years old. If my brother continued to use these vapes, since they have a variety of different flavors that he likes, then it would distract him from focusing on his work and balancing his school life. I understand that the balance between school and work is tough, and that the easiest coping mechanism would be to just vape as he's seen his coworkers vape around him. However, the main reminder is just because you are young does not mean you are invincible. As my little brother started to vape, he complained that he had headaches after he kept using the same blueberry flavor vape until it had no more flavor on it, which started to leave a bad taste in his mouth. Once he was exposed to tasting the vape with no more flavor inside it, he did not want to vape anymore. And now he has not vaping ever since he experienced the true taste of vaping, when the flavor dries out, which had disgusted him. By banning the flavored tobacco products, we can give the youth in Gardena protection from the harms of tobacco so that they cannot experiment with vaping as a harmful activity. Thank you all for listening.
Thank you so much, Randy, for your insightful testimony. And now we're going to invite Melissa Loza. Melissa, the floor is yours.
Hello, everyone. My name is Melissa Loza. I'm a Gardena resident. Vaping and flavored tobacco products have been known to be very addictive and tempting substances to youth. It is important to minimize exposure and access to youths, especially in the city of Gardena, because it has harmful health effects. An example of one is the negative effect on the lungs because of the inhalation of chemicals and metals. And two, the flavors. Just as we saw, there was over 15,000 flavors of vapes. And just like many flavors, gummy bear is a sweet and recognizable and lures youth to vape. Let me tell you about my vaping experience. When I was 18 or 19, I was exposed to flavored tobacco from my college friends, and I still remember the tropical fruity smell that came from the vape. I was asked if I wanted to take a hit from the vape and was reassured that there was no nicotine or harm from the vape. Knowing myself, I denied it because I knew about the dangers of tobacco use at a young age. Thinking about it now, if there was another teen in my position with no knowledge about vaping, they would have accepted without a worry in their mind. That is why it is important to educate youth and parents about vaping flavored tobacco products, because it could aid them in making decisions in the future. In addition to my vaping experience, I'd like to share the importance of educating the youth. I have a 7-year-old sister who is exposed to many things on the internet and through family and friends. I want to teach her dangers and harms of tobacco products and teach her refusal skills. Refusal skills are necessary to prevent someone from influencing or showing her any vape products. In my case, I knew when my friend offered the vape product and disguised the harms and dangers attached to it. So, helping the youth understand the harms and recognize these products are extremely important to me. As an older sister, I want the best for her, and I want her to live a happy and drug-free life. So aside from education, I fully support a flavored tobacco ban in the city of Gardena to protect youth from the dangers and consequences of tobacco use. Thank you.
Thank you, Melissa. Yes, speaking to youth is so important. It doesn't matter how young they are, and you being a big sister and teaching her the harms of tobacco is going to go a long way for her to really bump up her refusal skills. So I'm glad that you're being that role model for her. And with that, we're going to go to our third speaker, Liz. The floor is yours.
Hello, everyone. My name is Lisbeth. I also go by Liz, and I am an alumni of Gardena High School and their high school task force. And for those of you that don't know, High School Task Force is a club organized by AADAP that helps teach the youth about alcohol and drug awareness as well as prevention. And I was very lucky and fortunate enough to participate my senior year in high school. Unfortunately, it was cut short due to COVID, but I have many memories, some of which I got to speak at a city council about a year ago. And I also participated in Photo Voice Project, which was really fun and memorable. I think we all know the harms of tobacco and their marketing skills that they use to lure children into using their products. And one of the most prominent examples I would like to use was during my time in high school. I had a lot of friends who would often smoke or just sell the product, maybe not smoke it. I would often see on my Instagram feed, Snapchat feed, social media in general, how they would say, oh, my cousin has sells this. If you want to, buy any of these products, go ahead and hit me up and I can get it to you in school. And I thought that's really shocking because these are children, selling and promoting this product that older cousins or even siblings were selling. It's really easy for older people to get their hands on these products and, give it out to children as if it were candy. And these kids, these teens, they don't know the harm they're causing to themselves. Over the year, this quarantine, I've seen that, especially in my apartment complex, the amount of smell that there is from all these different products, it's become stronger. Obviously, we're all locked up. We have nothing to do, nowhere to go. And some people just turn to vaping products or smoking other substances. And I'm scared because these wrappers, they're so colorful. You know, children see them on the ground and they think, oh, it's like a candy wrapper. They pick it up the ground, they think, oh, it's probably some type of candy. They might eventually get their hands on it and they might become addicted. It's really scary to think about these things because these children are supposed to be the future, our future. They're supposed to guide us into a stronger nation. And if we don't protect them now and teach them the wrongs of these products and these companies, they will never know. Over this past quarantine, I've also seen a lot of vape products being promoted on TikTok, a very famous platform I think we all know. And it's I've seen it on my brother's For You page. You're there for his feed. He's only 7. People smoking, doing these cool tricks with their vapes. And it's really not cool when it's being promoted to children who don't know the realities of these products. That being said, I fully support the ban on flavored tobacco products, and I think we all should if we want to protect our future generation. Thank you.
Thank you so much, Elizabeth. Yes, it's very important. I know that in this audience, we have a lot of parents, and parents, please be vigilant. Like Elizabeth said, the marketing companies are tricky. They try to get your kids lured in with the marketing tactics that they have on social media platforms. So take a look at what they're looking at. Be cognizant. It doesn't matter if you're being nosy. You're their parent and you need to protect them from the harms of these products, these flavored products. I can go on, but I do want to thank Randy, Melissa, and Liz for sharing your own personal experiences. And we commend you all for being some great advocates for spreading the word of a healthy lifestyle and not partaking in these products. So right now, what we want to do is we want to go ahead and open it up for question and answer time for you. We do have a question and answer box. So if you do have a question, go ahead and type it in there. And Jeannie Shimatsu, my supervisor, will go ahead and monitor the question and answer period for us. So with that, we are going to open it up for questions.
Or Tracy, if you don't mind, I can manage the, if anybody wants to just raise their hand, do their virtual raise hand, and I can unmute them as well.
Okay, that's perfect. I also wanted to recognize some people in the audience. Can I do that quickly while people are thinking of their questions? I know we have a couple of council people here. Mark Henderson is here. Art Cascanian was here. He had to go to another meeting. Council member Paulette Francis is here. And we also have Captain Vincent Sorio here from the Gardena Police Department. So I want to welcome you and thank you all for your wonderful support of our work. Anything yet?
If anybody has a question, you can use the icon on the bottom, raise your hand, and we can unmute you.
Yeah. Don't be shy.
Councilmember Francis, you can unmute yourself if you'd like.
Okay, I just wanted to thank GDAAP and AADAP and you, Ms. Martinez, for putting together this town hall, this very informative town hall about flavored tobacco products. And I've learned some new things. There were some things I thought I knew quite a bit, but I have been enlightened tonight as well. So thank you very much for supporting our children and encouraging them to lead healthy lifestyles. Thank you, and warn them of the dangers of vaping and cigarettes. Thank you.
Thank you.
So I also want to thank you for this presentation is very informative, and as Councilmember Francis mentioned, I learned something as well. So it's good information, And what I would like to do is take this to our schools, directly to our health classes at the middle and the high school level. And perhaps at this point, even continue to have some more town hall meetings, or have you join us. I would love to collaborate with you to continue to get the word out. So I do want to appreciate, or thank you for everything that you've done to make sure our community stays safe.
Thank you
And
so much, Ms. Martinez.
you're very, very welcome. It doesn't look like we have any questions. I imagine the presentation was very thorough and informative. So there's no questions at this point. If Carol, if you want to sign off, and that will be the end.
Yeah, so I'll pass it on to Jessica.
Yes, so thank you all. Thank you, Ms. Martinez, for allowing us to present today. And thank you everyone who is viewing at home virtually. We want to send you off with some of our context. So if you would like to take a screenshot of this, please do so. We have Carol Almeida, project coordinator, Tracy Sarwatari, GDAAP chairperson, and myself, Jessica Abaya. And with this, we want to just tell you all watching at home, thank you so much.
Yes, and thank you to the Gardena Community of Schools, led by Ms. Rosie Martinez, and to the community of Gardena itself. So this does not stop here. Information and education on the issue will continue, and community will be engaged for as long as there is the issue. Thank you so much.
Thank you, everybody.
Thank you, everybody.
Good night.